So we were talking to Judy in all these interviews that we've been doing with her, and a lot of times she'll ask us, where did we start, each of us start our interest in plastic surgery? How did we start Renaissance all to begin with? Stefan and I have been working together for probably almost 20 years since medical school, and then got into residency together and ended up wanting to start our own practice. We met Paul about 14, 15 years ago when he was a student and we were residents. We always had an idea of starting Renaissance Plastic Surgery as a practice that encompassed all of plastic surgery, all of the reconstructive and cosmetic issues involved, because we all enjoyed every aspect of that. We took a lot of ideas from around the country and all the different places we'd been before then as to how a plastic surgery practice flows from patients coming in through the front, greeted in a cosmetic spa-like setting, having a post-operative area that had easy access with covered parking, and all of those nice amenities that are behind the scenes that makes the whole experience so much better than just coming in and out of a door on the 4th floor of some building next to a hospital.
And it, Mark, not to interrupt you, but it was such an adventure looking back. There was no book to say this is how you do it. This was you and I in the beginning just saying, okay, what kinds of things do we find that would lend itself to a high quality cosmetic surgery practice and or a reconstructive practice, and how do you separate those two components in the practice, whether it be a hand surgery or let's just say a facelift or something like that. And I thought that was really fascinating. We were calling people all over the country back in the day, and here's two total newbies into the world of plastic surgery, and really just trying to develop this on our own. And it was, I think, to some extent through trial by error, and really fortunately for us, I don't think there were too many errors along the way. But I think it was an adventure that has really been in the making for 20 years, and it's been great having Paul on. I think how many years now? 6, 7, 8, maybe. I'm trying to think.
Somewhere around there.
6, 7, 8. Yeah.
Seems like 20.
And for me, I came at this from a completely different aspect, because the two of you had essentially started the practice and established many of the things that you wanted a plastic surgery practice to be about. And one of the things that I really enjoyed was how patient-centered your practice was. When did you figure out you wanted to do plastics? Specifically.
I remember the day I was walking down the hall and I had been trying to figure out, going through research in ENT and some other things, and I was just kind of bored with the research topics. And I remember this resident popped out who I'd worked with, and he goes, come on in here at our lab. And he was in plastics. And he says, this is what we do. And he showed me, and I was like flipping through their books, looking at them like, this is really cool. I didn't know this. He goes, what are you doing that for? You should do plastics. I'm like, really? Okay, so I went and I was starting an ENT rotation the next week, and I switched it over to plastics, and it was, I think, the second day I got in there and I went, this is what I want to do the rest of my life. I had thought about dermatology, which I really like, and ENT, but plastic surgery sort of encompassed a much greater, fulfillment of what I wanted out of a surgical fellowship.
You know, it was kind of funny that you mentioned ENT, because whenever you get into medical school, during your 4th year, you do a variety of rotations through different medical specialties.
Yeah.
And my first one happened to be ENT. And that was one that I was considering, but I had a friend a year ahead of me who'd said, oh no, you got to do plastics. It's just the best thing in the whole world. And I'm like, okay, yeah, maybe. I went through my entire month of ENT, and I enjoyed it. I thought that they were good people to work with, and I enjoyed the patients. But it took me all of about 2 days on my plastics rotation to say, what was I thinking? This is what I want to do. This is great. And specifically, it was a case early on where it was like a 23-hour surgery where a gentleman had a cancer of the base of his tongue, and he had to have his jaw partially removed and so on. And we came in as the plastic surgeons, reconstructed the jaw from a bone and some tissue in his leg. And it's like, isn't that just the coolest thing ever?
Right.
To be able to do some of those big surgeries, and then how that transitions into some of the things that we do every day. And the good thing is that we've added that ancillary staff, whether it's skincare or it's our nurses, it's our coordinators. They all really care about the patients, and they seem to know what it's all about.
It's funny, Stefan found, I think, the two nurses that are two skincare nurses. We would be all over the hospitals and try to find the best nurses. I remember every time you'd come in, I found another nurse. This one, we got it. She's great. You got to meet this one.
The search.
How many times did we bring Ann in for an interview? She got to be like, are they ever going to hire me?
I think that relates a lot to the why and how we've become successful. It's great to get to know patients, and I think that is what drives you. It's the nice batch of cookies they may bring, or a simple thank you when it's all over and done with. And all of us, I think, have individual stories over the years of people that really had no means whatsoever to pay us, and it's probably in some ways one of the most gratifying experiences we've had. So
I like the ones that pay too.
Keeps the doors open. Keeps the doors open. I think originally I thought I wanted to be a trauma surgeon, and did some time up in Chicago with the Gun and Knife Club, and ultimately found out that wasn't what I wanted to do. Ran into Mark along the way, and then ended up sneaking into plastics. It was a wonderful. I hadn't really done any plastic surgery as a medical student at all. I didn't know that I wanted to do it, and my first rotation in my training in general surgery was plastic surgery, and really fell in love with it. And ultimately, Mark and I became a dynamic duo there, and after 6 years, we decided to say, hey, what do you want to do? He's like, I want to go back to St. Charles. My wife was from St. Louis. I said, let's go back.
That's where it all started.